Alfie was born slightly premature, so his progress was a bit slower. He had a very unfortunate accident that caused him to have a major surgery. It also slowed down his development. At 5 months, that kind of fall is very scary for us. We actually did ask the neurosurgeons, will this affect him long term? The answers were just only time will tell.
之前的时候，已经看到陌生人，他都会吓到会哭，然后一直要我们抱他。在上课的时候，他会不专心，他会跑去后面玩，然后去干扰别人上课啊。表达能力他会比较差。
他每次吃到一半，然后就要人家喂他，
没有办法独立去完成一样完整的东西。
对，没有办法。
Back in 2009, community intervention services was scarce for preschoolers with special needs in the heartlands. MIP 1 broke new ground by bringing specialist care into 25 preschools to support preschoolers 5 to 6 years old with mild special needs. It was the first time that hospital staff worked inside the community. To date, the program has been scaled to over 800 preschools under the DSLS umbrella.
One of the bases of early intervention. The brain is still very malleable and plastic, so it can change more easily. The capacity of the brain to be able to adapt and respond to changes in the child's experiences, the child's learning from 0 to 5 is probably the best time. One recurrent question about MIP 1, which serves K1 and K2, was why don't we go to a younger age group, which makes sense if identification and support and intervention should take place as early as possible.
Traditionally, we have been on the receiving end of intervention. Children are referred to us after having identified delays, but we ask ourselves, can we get ahead of that curve? Can we proactively identify and support children earlier before challenges become difficult?
MIP2 is Mission I'mPossible 2, and we bring together education, social and health services together within the preschool setting. So we provide early identification, screening as well as support for children from 2 months all the way to 4 years old.
In MIP2, KK Hospital guided PCF to establish their own in-house multidisciplinary team so that they can better support 16 big preschools in the Northeast.
SEDU is the school-based child development unit. It was set up as part of MIP2. It comprises of speech-language therapists, occupational therapists, early interventionists, psychologists, preschool nurse, nutritionists, and curriculum specialists as well.
The flow begins with universal surveillance to all our children from 2 months all the way to 4 years old. It's a surveillance checklist that is extracted from a developmental checklist that our educators and educarers are already familiar with. Children who have needs are being identified with this surveillance checklist, and then a screener is being done by the educators so that their level of needs could be tiered. For children who require more support, they are then right-sited to the appropriate services, be it referral to EPIC centers, early intervention centers, or DS Plus program. We also work closely with EPIC partners if our children are dual schoolers.
There were 2 differences with MIP2. One is that we've gone upstream now. The second part of MIP2 that's a bit different is that we've included 2 health components. One is growth, and the other one is oral health. One of the first things that we tried to do was to actually standardize the taking of height and weight so that it's accurately done.
Good job. Thank you.
The second was we tried to have pathways for when we identified deviations. Similarly with oral health, we are looking at picking up early childhood caries because that's increasingly a problem. What we are using is called the lift the lip approach, where the preschool teacher is trained to lift up the lip and then look at the front teeth.
By introducing early identification, early referrals, and strategies in the daily routine of the child. By empowering teachers and families to be active participants from the start, MIP2 strengthened the role of the immediate learning context of the child's development. This approach not only accelerates access to support, but also equips educators with tools to respond early and effectively.
In early intervention, actually, one of the tenets is having early intervention and support in a child's natural environment. A child may not be able to pay very good attention in preschool. And he goes for therapy and a therapist and learns some skills. But when he comes back to class, what happens? It might be the same thing, right? So in this case, it's a good thing if the intervention and support take place in preschool because it is already in a child's natural setting. And this transfer of skills could take place with the teacher being a mediator of it. There's the opportunity for peer modeling, peer learning. There may also be difficulties that a child only faces in the preschool setting. For example, focusing in a large group, initiating play with his peers.
1, 2, 3, let's draw.
Before MIP2 comes in, most of us are unsure on how to help children with developmental needs. Most of the time we go by our gut feeling, like what the child needs and wants.
Initially, we were not aware that they're actually struggling. We went for the training and then we get more awareness of MIP2 and what the child is going through, the developmental part. We realized that this child needs help and we are going to help this child.
With MIP2, we have a clear structure and framework which gave the teachers a clear direction in how to help children with developmental needs. One key technique that I learned from MIP2 would be the power of visual support, such as visual cues and daily schedules. It does not just benefit the children with developmental needs, it also benefits the whole class.
Why did we wash our hands? Very good, yes.
Other strategies would be social stories. I will read to the children on how to help one another and how to support one another. Another thing would be setting up a calming corner. All the children can go there, and there's also sensorial materials placed there to help them regulate.
Most of the children were not able to speak up, so they use their gestures more, if they like more, showing thank you and please if they need help.
Okay, very good, Kia. Would you like me to open? Say please first. Oh, okay, well done, Kia.
My role as an inclusion coordinator is like a bridge between the teachers, the parents and the children, and how we can help all of them together.
EVA 的老师跟 PCF 的老师，他们会一直联系 Grace 每个成长过程的那个状况啦。他在 EVA 的时候，老师会怎么辅导他去自己吃东西、自己表达要上厕所、洗手，然后就建议 PCF 的老师用同样的方法继续引导他。
Teachers also can implement strategies, especially during routines, and it's in a child-safe and natural environment.
For Alfie's 9-month regular check, my husband brought him to KK. He was severely underweight. He wasn't sitting upright yet, so he wasn't able to eat solids. He doesn't have the strength to develop further in terms of muscles. We actually reached out to the teachers, and Miss Rina actually helped Alfie to find a chair, one that can recline and help him to build his posture. From there, he was able to be fed solids, or you started to see he is sitting very well. He's very stable.
自从 Gladys 上了 EVA 的课程，有看到他进步，有在讲话，有在互动，也是有所自己的想法。
When MIP2 was firstly introduced to me, I was a bit apprehensive, quite hesitant, because in preschool sector, we are quite heavily involved with children day in, day out, so we worried was there any additional administrative matters or perhaps another set of resources that need to be put into the classrooms, increases the teachers' workload.
The challenge was to change the mindset of teachers to follow MIP2 way of helping children.
We do try to make use of what's already familiar to our teachers and educators so that when implementing strategies, it doesn't feel it is something that they have to take on additional tasks or work.
Since embarking in the MIP2 program, my center was able to effectively implement surveillance in terms of detecting developmental needs in our young children. After detecting, my center is able to know what step next to meet the needs of the child. We know that the resources provided and implementation would come in quite efficiently.
We gave the teachers a lot of support, a lot of assurance, and there was a circle of practice within our center discussing what are the challenges and how we can help one another. And at the end of the day, the teachers realized that inclusion is not about doing more things, it's just doing things differently to help the children with developmental needs.
The most fulfilling is when I see my teacher grow in terms of their professional development. It gives them self-confidence. It makes them enjoy their work journey as a preschool educator. Secondly, to see my children enjoying coming to school. When they enjoy coming to school, when they are happy coming to school, they are learning day in, day out. Fulfilling is when I see parents truly benefit from what the center offers.
He started to go on 4 so that he can crawl. He is very confident as well.
他比较爱讲话了，比较好动。看到爸爸妈妈，他会讲爸爸妈妈，我回来。
MIP2 has definitely brought relief for me and my husband. It's very reassuring to know that in school, there are not only the teachers, but also the MIP2 team. Everybody's working together to help Alfie in his development.
Enhancing child development was our mission, and we are able to mobilize different big players to come together to address the problem. Behind the partnership is actually a confluence of a compelling vision, purposeful professionals and assistants. We do have a bold vision that's backed by leaders with strong conviction to place the needs of children and their families at the center.
At the end of the day, my goal is to get my children to lift each other up and to understand how to lift each other up.
Even if they need extra help, we don't want our child to feel like they're being left behind. So this MIP2 program, they actually go into the preschool center and observe and also help in the center itself together with the teachers. It creates an inclusive environment. Everyone is in a space together, learning together, even if different children have different learning needs.
Inclusion seems hard at the beginning, but at the end of the day, the culture is wonderful, the children benefit so much, and the teachers even more.
So MIP2 stands as an actionable blueprint for inclusion. It is an investment in our future and our commitment to support the national ambition to maximize human potential from early life.